we'll close the session. All right, so still on sexual abuse. Obtain as much information as possible from the child and any witnesses. Transport all children who are victims of sexual assault. Sexual abuse is a crime. Cooperate with law enforcement officials in their investigations. Sudden infant death syndrome. Unexplained death after complete autopsy. About 3,000 to 5,000 infants die of SIDS annually. Baby should be placed on his or her back on a firm mattress in a crib free of bumpers, blankets, and toys. Baby should sleep in the same room, but not the same bed, chair, or sofa as an adult. It is impossible to predict. Now, risk factors: mother younger than age 20 years, mother smoke during pregnancy, low birth weight, can occur at any time of day. You are faced with 3 tasks: assessment of the scene, assessment and management of patient, communication, and support of the family. All right, now patient assessment and management of SIDS. And it's funny because a good friend of mine this morning was telling me about a situation that occurred last night where a 3-month-old baby died, and they're not able to determine exactly what went wrong, right? And it's a SIDS case, and here we are reviewing it on the slide. So patient assessment and management. Victims of SIDS will be pale or blue, not breathing, and unresponsive. But it's important to find out what was the presentation prior to that, right? Did the child make unusual sounds, grunting? Was the child, what happened prior to the baby becoming blue is very important. How was the baby fed, right? Is it the bottle feeding or breastfeeding? Because sometimes they're overfed and they don't burp them properly, and they put them to lie down and they start to vomit or puke, and that comes up and goes into the ear passage, right? And it can result in SIDS. So other causes include overwhelming infection, child abuse, airway obstruction, meningitis. Continuing with other causes: accidental or intentional poisoning, hypoglycemia, congenital metabolic defects. Begin with ABC assessment, provide intervention. Now, one of the things that I would encourage any mother to do, or parents to do, once you have a young baby, ensure that you do a little CPR class, right? That's going to be extremely important. They can get good airway, upper and lower airway management. If that is good, if the ventilation management is good, you can save the infant life, right? That's what is going to bring them back. They will go into cardiac arrest because of airway issues. So if you can do a good job with those ventilations, it's going to make a huge difference. Now, depending on how many time has passed, patient post-mortem changes, rigor mortis dependent lividity. Rigor mortis is when the skin becomes stiff, right? And dependent lividity is pooling of fluids in the lower portion of the body. If you see these signs, call medical control. If no signs of post-mortem changes, begin CPR immediately. As you assess patient patient pays special attention to any marks or bruises on the child before performing any procedures. Note any interventions that were performed before your arrival. Right, scene assessment, carefully inspect environment, noting condition of scene where the infant was found. Assessment should concentrate on signs of illness, general condition of the house, signs of poor hygiene, family interaction, site where the infant was discovered. All right, now communication and support of the family. Sudden death of an infant is devastating for a family, tends to evoke strong emotional responses among healthcare providers, allow family to express their grief. Death of a child. In addition to medical treatment, the child may require you must provide the family with empathy and understanding. Now, having a pediatric patient, losing a pediatric patient in the field is tough, right? And it is by far one of the toughest cases you will experience, right? It is not fun to lose a pediatric patient in the field. It can happen. We have to have emotional support to deal with it. You can end your career, right? I have a paramedic friend that this was the reason why he left the field. He had a series of bad calls with pediatric patients, and he was at a point where he just could not deal with it mentally anymore, and he left the service and went into nursing. So these are tough calls, very difficult calls for the responder, caregivers, and family members, right? Just keep that in mind. The family may want you to initiate resuscitation efforts, which may or may not conflict with your EMS protocols. Introduce yourself to the child's parents or caregivers and ask about the child's date of birth and medical history. Do not speculate on the cause of the child's death. The family should be asked whether they want to hold the child and say goodbye. The following interventions are helpful. Use the child's name. Speak to family members at eye level. Use died and dead instead of passed away or gone. Acknowledge family's feelings, but never say, I know how you feel. Bad thing to say. Don't ever say that. Offer to call other family members or clergy. Keep any instruction short, simple, and basic. Ask family members if they want to hold the child. Wrap the child in a blanket and stay with the family while they hold the child. Do not remove equipment that was used in attempted resuscitation. Everyone expresses grief in a different way. Death of a child. Some will require intervention. Many caregivers feel directly responsible for the death of a child. Some EMS systems arrange for home visits after a child's death for closure. You need training for these visits, right? As I said, these are going to be difficult calls to deal with. Child's death can be very stressful. Take time before going back to the job. Talk with other EMS colleagues. Be alert for signs of post-traumatic stress in yourself and others. Consider the need for help if signs occur. Now, apparent life-threatening event. Infants who are not breathing, cyanotic and unresponsive sometimes resume breathing and color with stimulation. Apparent life-threatening event, that's what it is called. So they look as if you're having issues breathing, and then that presentation changes. Classic ALTE is characterized by distinct changes in muscle tone, choking, or gagging. After ALTE, child may appear healthy, show no signs of illness or distress, must complete careful assessment and provide rapid transport to the ED. Pay strict attention to airway management, assess infant's history and environment, allow caregivers to ride in the back of the ambulance. Physicians will determine the cause. And that's the end of pediatrics. It's a long chapter, very long. A lot of stuff in pediatric is repetition, right? A lot of the medical conditions is repetition. When you are going through the chapter, focus on what is different. So the developmental ages are important, the different stages of development. The anatomical differences, so the differences in anatomy and physiology and how that will affect the child is important, right? Those are important things. The pediatric assessment triangle is a new thing in their patient assessment. One of the most consistent management throughout the chapter is airway, upper airway and lower airway management. So if you're able to manage their upper airway and lower airway, minimize their risk of infection, maintain their body warmth, you will save these patients in the field, right? So focus on what it is that is different. Don't go over things that you already know. And if you don't know them yet, you need to know them now going forward. So that's a pediatric chapter. Any questions? I'm getting a ton of messages. Oh boy. Yes, Mr. Jennings, go ahead.
Hello, good night, sir. How you doing? Quick question, right? So let's say you're out on the field, you had a good couple of rounds of some severe trauma, some from all age groups, and you start to see yourself developing maybe some signs of PTSD, right?
Yeah.
How would you what I say now? How would you what's the best approach in returning back to the field?
Well, that's a difficult question to answer, Mr. Jennings, because everybody is different, and every situation will be dynamic, right? I come in, Miss Dennis. I can recall losing my first patient in the field and how that affected me as a young EMT on the job. And that call had some pretty extreme circumstances. So one, I wasn't fully trained as an EMT as yet. I was just given some on-the-job training and sent out to run calls, literally, right? And so all I knew at that particular time was how to do vitals. I knew how to do vitals, and I knew that if the vitals were out of whack, oxygen would be beneficial. I should give oxygen, but I didn't know what the oxygen was doing for the patient because I just had about 2 weeks of on the job. And I remember getting a call for a patient at a private hospital. And when I went to that hospital and assessed the patient, I knew that this patient should not be leaving that hospital to do any tests. So they were sending the patient to another facility to do a test. And the patient was just not in good shape. Everything was out of whack. And the patient was grossly unstable. And I even recall saying to the doctor, "You sure you want to send this guy to Apex?" And him say, "Yeah, man, wrong with him? And like, right? And the long and short of it is that that patient ended up dying, right? And that was the first time I experienced a patient taking their last breath. Prior to that, I would find them dead already, and I was okay. That was the first time I ever saw a patient take them last breath, right? And I felt helpless. It bothered me because I kept wondering if I had gotten full training, would it have made a difference for this patient? And it bothered me a lot, right? I started to think about it a lot. I wasn't able to sleep properly. And for, I think for about 3 weeks, 2 to 3 weeks, I could not ride the ambulance. I was not able to ride the ambulance. And I I remember having a conversation, a long conversation with my partner at the time, right? And we had a conversation about the situation. And the end result was he said to me, you did everything that was within your capabilities for this patient, right? And he said to me, learn from the experience, right? Learn from the experience and just understand that there will be limitations and you won't be able to save everybody. But do what you can do because you don't know when what you have done is gonna be the difference between life and death for a patient, right? So I at that point I say, okay, I've lost one. There will be a situation where I'll save another, right? So I'll get that opportunity to save another patient. And I mean, having that conversation with my partner that day is what changed my mindset and how I felt. Right after that, it did not bother me anymore. But it can be so bad that you need the what they call them, the psychiatrist or psychologist, whichever, right? Where you have to go in. I think they have something that's called psychological first aid, right? I don't like the critical incident stress debriefing because to me it's more of like you're blaming the responder. I think the psychological first aid is more beneficial, right? So that's what I can say on that. And I can say to you that talking about it will help you to get over it, right? If talking about it might not do anything at all for you. You may need that medical intervention, right? Yes, Miss Dennis, you had your hands up.
Sir, you covered it already. I was going to say that you might need professional help depending on how it affected him really, based
Yeah,
on what he's experiencing. So talking to somebody else might help, but he might actually need professional help, or might
right,
actually need to change from the actual job and do something else.
right.
Because some persons, when they experience post-traumatic stress, it doesn't only affect them mentally, but it also affects the physical person and how they interact with other persons and their day-to-day activities. So it might need more than just talking to a colleague, and
Yeah,
actually need some real help.
I agree. I agree. Yes, Miss
Can you go?
Elizabeth. Go
Sir,
ahead, Miss Elizabeth.
do you have peer reviews like under normal circumstances, sir? Like you would go and you go through the system of telling what you did to respond to a call, so you improve the quality control of the overall service. Do you have that
In
peer
the
review?
in the States, yes. When I was working as an EMT riding the ambulance in Jamaica, which is I would say 10 years ago, maybe more. when I was working with my partner, one of the things that we would tend to do is when we come from the call, we would go through what it is that we did on that particular call, what is it that we could have done better, and how we are going to make adjustments. So, and that was just something that we decided that we would do as a crew, right? But by law, we should have some mechanism in place to review the run sheets, review the calls, look at what is being done, whether or not it's working, stuff like that, right? As it exists now in Jamaica, I cannot speak to it specifically in terms of what is happening. I do know that within the fire service, the district officer that is in charge of that EMS section reviews the run sheets. And sometimes in some areas will go on advance as well to just observe what's happening in the field. So yeah, that's the current situation. Right? Now the other thing about the PTSD, we have to recognize when something is wrong, right? We have to recognize when something is wrong. Because I remember watching this documentary on a guy that went to war. I don't remember which one. I think it was the Vietnam War. And when he came back, he had PTSD and he was not able to function properly in society. And they kind of ignored it. They kind of ignored it and just brushed him one side. Didn't seek the help that he needed. Didn't provide the help that he needed. And it reached a point where it was just a routine stop, right? A police officer pull him over to, I think it was something to do with his brake light, and wanted to have a conversation with him, and he refused. And the police officer is pleading with him, and he refused, and he went back to his truck and took out his weapon, and he took a, what you would call it, a tactical position, right, and maneuvered tactically, and he pointed his gun inside of this police officer, right? And when the police officer fell, he walked up to him and put another one in his head. And after that, he snapped completely. And the end result is the police force had to kill this guy, right? They had to kill him. And it's all because he didn't get the professional help that he needed, right? War is devastating to the mind. EMS has the same effect, especially when you really love and enjoy what it is that you do, right? And I've said this to you guys before, there are some cases you will never forget once you experience it in EMS, right? There are some cases, no matter how old I get, I will never forget the experiences I've had in the field for those particular cases, right? And you either are at a stage where you can deal with it or you're not. And if you realize that it is not for you, then you have to step away. And for instance, recently I got a call from Cayman, and it was regarding one of the EMTs that I sent over there to work. And it appears that he's struggling. He's having issues dealing with the calls emotionally. So he's not able to balance his emotion and the need to carry out his duties. The calls are affecting him to the point that he's forgetting to do things that he needs to have done for the patient, right? And the discussion I had with him was, I said, listen, you have to decide if it is something you can handle emotionally, right? And if you're not able to do it, nothing is wrong with that. If you cannot manage it emotionally, then you need to step away. Because when you get to the point where the job is affecting you emotionally to the point that you're not able to do what you need to do for the patient, then you have a problem, right? So that is the other side of EMS that we don't really speak about that much, right? But if you work in a busy system, you have experienced a lot, right? So these firefighters, especially on the tourist end and in Portmore and Linstead, where they have a EMS, they have been through a lot. They have seen a lot, right? And they are rarely acknowledged or appreciated. Some of them go home and have sleepless nights. Some of them after the call, because we don't cry in front of our patients, right? We have to cry away from the patients because we don't want the patients to see us crying. But a lot of them cry after the calls, right? So it is what it is. We either go forward or we step out. And that's EMS. That's EMS. Yes, Miss Nesbitt.
Sir, as you